I think it's important to distinguish that our rehabilitation program is really for that kind of post-treatment Lyme patient. So if we're suspecting an active Lyme infection, they really should be following up with a medical doctor for potentially further antibiotic treatment. And what they would kind of expect to see with that is like a new onset of fever, joint pain that's migratory and progressive that we can't really associate with like an increase in activity or a specific level of exertion. If a patient is coming to us and they've already undergone treatment, but they're still living with symptoms or issues, then we can look to see what kind of patterns these symptoms follow. So if they're developing pain after exercising, is this related to a post-exertional malaise type presentation? Is this kind of expected or normal pain for somebody who hasn't done resistance training in a while? So we do have to use kind of some clinical decision making and always make sure that patients are medically stable before we undergo any type of rehabilitation. Well, we can use data with any post-infection patient, but specifically with Lyme patients who are struggling to figure out the right amount or level of activity that they can tolerate. So we can look at data trends and see what we would kind of expect to see in a day or two after an exertion or an exercise, and then what maybe might indicate that they did not tolerate it. And then we can kind of make that distinction for the patient and then help them to modify their program. So with Lyme patients or post-treatment Lyme patients, we want to make sure that any movement prescription is very gentle and helps to kind of reintegrate the brain and the body together. So we'll do things like proprioception exercises, which is helping patients with their balance and their kind of sense of their joint positions in space, and using movement as a way to kind of reintegrate those systems. And certainly, much like with some of our other post-infection conditions, we're not looking to push them kind of beyond their current capability or push them into symptom flares using exercise.